Welcome, future nurses. You have officially arrived at day 19 of our unstoppable 30-day NCLEX challenge. And if no one has told you yet, you are crushing it. That is right. You are now just 11 days away from completing all 30 full-length NCLEX practice tests, and by now, you have already conquered over 1,200 of the most frequently repeated NCLEX questions. But before we begin practice test 19, let me hook you up with something extra special. For a limited time, we are giving you free 5-day access to our complete NCLEX crash course. No payment, no card, no catch. Just click the WhatsApp link in the description and type the word "Hi." That is it. Our team will instantly enroll you and unlock live-in recorded NCLEX classes, next-gen NCLEX, NGN, case studies, over 5,000 real NCLEX style questions, PDF notes, plus expert educator support, and custom study plans for both 1 week and 1 month prep. This is your chance to boost your score, fine-tune your weak areas, and walk into the NCLEX with full confidence. And it is all absolutely free for 5 days. So now, let us do what we came here to do. Grab your notebook, silence those distractions, and power up your focus. Because practice test 19 is packed with clinical gold. Let us keep pushing forward, one question at a time. You have got this, and we are right here with you. Let's start with question 1. A nurse is performing a physical assessment on a client who has been diagnosed with Paget's disease of bone. And the question is, which of the following clinical findings should the nurse most expect to observe? The options are as follows. First, A. Bone deformities. Second, B. Berry aneurysm. Third, C. Heberden's nodes. And finally, D. Janeway lesions. The correct answer is option A. Bone deformities, as they are a hallmark of Paget's disease due to abnormal bone remodeling, leading to enlarged, weakened, and misshapen bones. Clients may experience bone pain, skull enlargement, or leg bowing. Option B, Berry aneurysm, is linked to polycystic kidney disease. Option C, Heberden's nodes occur in osteoarthritis. And option D, Janeway lesions, are seen in infective endocarditis. None are related to Paget's disease. Now, moving on to question 2. A nurse is creating a post-operative care plan for a client who has just had a lumbar laminectomy. The question is, which intervention best protects the surgical site and promotes spinal alignment during repositioning? The options are, first, A. Use the log rolling technique when turning the client in bed. Second, B. Apply a cervical collar. Third, C. Attach an overhead trapeze bar. And finally, D. Maintain a high Fowler's position. The correct choice is A, because log rolling moves the client as one unit without twisting the spine, minimizing movement that could disrupt healing. This technique typically requires 3 staff members to stabilize the head, hips, and legs. In contrast, option B, a cervical collar, is used for cervical spine surgery and is not appropriate for lumbar procedures. Similarly, option C, an overhead trapeze bar, encourages upper body effort that could strain the lumbar area and is contraindicated. Finally, option D, a high Fowler's position, increases pressure on the lower back and may hinder recovery. Next, let's look at question 3. A nurse is caring for a teenage client diagnosed with cystic fibrosis, who expresses frustration about missing school and appears socially withdrawn and unmotivated to participate in their treatment plan. The question is, which of the following nursing interventions would be most appropriate to support this client's psychosocial needs? The options are, first, A. Coordinate a video conference with another adolescent who also has cystic fibrosis. Second, B. Request a provider evaluation for potential antidepressant therapy. Third, C. Ensure a consistent nursing team is assigned for continuity of care. And finally, D. Arrange for an adult mentor to speak with the client about living with chronic illness. The correct answer is A, because adolescents with chronic illnesses often experience isolation and social disruption, and peer connection normalizes their experience, reduces isolation, encourages emotional expression, and builds community. In contrast, option B, antidepressant therapy, is not the first-line intervention for situational distress. Similarly, option C, consistent nursing assignments, help build trust but do not address the adolescent's developmental need for peer connection. Finally, option D, adult mentors, are less relatable than peers who share similar experiences. Let's proceed to question 4. A nurse is caring for a client who has just been diagnosed with acute peritonitis. The question is, Based on the pathophysiology and treatment goals, which medication should the nurse anticipate the primary healthcare provider will prescribe? The options are: first, A. Pantoprazole, second, B. Ciprofloxacin, third, C. Lactulose, and finally, D. Loperamide. The correct answer is B, because ciprofloxacin is a broad-spectrum fluoroquinolone antibiotic commonly used, often in combination with agents like metronidazole or ceftriaxone, to treat intra-abdominal infections such as peritonitis. Prompt antibiotic therapy is essential to prevent sepsis and reduce mortality. In contrast, option A, pantoprazole, is a proton pump inhibitor used for GERD and peptic ulcers and does not treat infection or inflammation. Similarly, option C, lactulose, is used to manage hepatic encephalopathy and has no role in peritonitis. Lastly, option D, loperamide, an antidiarrheal, is contraindicated because suppressing bowel activity can mask symptoms and worsen complications. Next up, here's a fluid intake calculation question 5. The nurse is calculating the total fluid intake for a client during one shift. The client receives several fluids, 2 doses of intravenous antibiotics, each measuring 100 milliliters, 2 cups of ice chips, with each cup containing 8 ounces, 1 8-ounce cup of coffee, and 3 8-ounce cups of water. Since 1 8-ounce cup equals approximately 240 milliliters, and ice chips melt and count as about half their volume, the nurse must remember to adjust for that. Based on this information, how many milliliters should the nurse document as the client's total fluid intake? The correct total is 1,400 milliliters. Here's how the calculation breaks down. First, the intravenous antibiotics. 2 doses times 100 milliliters equals 200 milliliters. Next, the ice chips. Each cup is 240 milliliters. But counting half the volume means each cup counts as 120 milliliters. So 2 cups equal 240 milliliters. Then the coffee, 1 cup at 240 milliliters. Finally, the water, 3 cups times 240 milliliters equals 720 milliliters. Adding all these amounts together gives a total fluid intake of 1,400 milliliters. Turning now to question 6. A nurse is providing discharge teaching to a client who has been prescribed guaifenesin for symptoms of an upper respiratory tract infection. The question is, which of the following client statements indicates a correct understanding of the medication's intended effect? The options are: A. This medication will help reduce my fever. B. I'll take this medication to relieve my cough and loosen mucus. C. I should take this medication with food to avoid stomach upset. And D. I'll need to limit how much fluid I drink while taking this medication. The correct answer is B, because guaifenesin is an expectorant used to thin and loosen mucus in the airways, making it easier to expel through coughing. It helps relieve productive coughs associated with bronchitis, colds, or other respiratory infections by increasing hydration of secretions and reducing mucus viscosity. In contrast, option A is incorrect, as guaifenesin does not reduce fever. Medications like acetaminophen or ibuprofen do that. Option C is incorrect because while taking guaifenesin with food might reduce mild gastrointestinal upset, it is not necessary or the main teaching point. Let's start question 7. A pediatric client is admitted with acute epiglottitis, and the nurse reviews the child's immunization history. Which vaccine most directly prevents this condition? The options are: A. Tetanus, diphtheria, and pertussis, TDAP. B. Influenza. C. Haemophilus influenzae, type B, SHIB. And D. Measles, mumps, and rubella, MMR. The correct answer is C. HIB, because it specifically protects against the Haemophilus influenzae type B bacterium, which was the leading cause of epiglottitis in children before the vaccine was introduced. Also, option A, TEAP, protects against tetanus, diphtheria, and pertussis, but does not protect against Hib bacteria, and therefore does not prevent epiglottitis. Option B, the influenza vaccine, helps prevent flu and related respiratory complications, but does not specifically prevent epiglottitis. Finally, option D, MMR, protects against measles, mumps, and rubella, which are viral illnesses unrelated to epiglottitis. Let's move on to question 8. A nurse is assessing a client with chronic obstructive pulmonary disease, or COPD, who presents with elevated vital signs. Based on the current data, which action should the nurse take first? The options are: A. Administer acetaminophen. B. Provide warm blankets. C. Apply oxygen at 2 liters per minute via nasal cannula. And D, notify the provider to obtain an arterial blood gas. The correct answer is A, administer acetaminophen, because the client has a fever that increases metabolic demand and respiratory effort. Reducing the fever helps prevent respiratory muscle fatigue and potential exacerbation of COPD. Also, option B, providing warm blankets, is inappropriate as warming a febrile client can further increase body temperature and oxygen demand. Option C, applying oxygen, is not needed since the client's oxygen saturation is above 88%, which is within the target range for COPD patients. Unnecessary oxygen could suppress the hypoxic drive and worsen carbon dioxide retention. Lastly, option D, obtaining an arterial blood gas, is reserved for signs of severe respiratory distress or low oxygen saturation, which are not present here. Next, question 9. A nurse is assessing a client receiving intravenous fluids through a peripheral vascular access device when localized swelling and tenderness appear at the intravenous site. What should the nurse do first? The options are A, stop the infusion and remove the PVAD, B, remove the dressing and try to reposition the PVAD, C, encourage range of motion exercises with the affected arm, or D, lower the affected arm below heart level to promote drainage. The correct answer is A, stop the infusion and remove the catheter, because these signs indicate infiltration, meaning fluid is leaking into the surrounding tissue. Also, option B, repositioning the catheter, is unsafe and may worsen tissue damage or infection. Furthermore, option C, encouraging range of motion, does not address infiltration and is not the priority. Lastly, option D, lowering the arm, would increase swelling. Instead, the arm should be elevated to reduce edema. Moving forward to question 10. During a disaster preparedness assessment, the nurse is asked to identify which scenario represents an external disaster. The options are A, a hospital-wide computer system failure, B, a nursing staff labor strike, C, a mass shooting at a nearby public park, and D, a chemical leak within the hospital's critical care unit. The correct answer is C is correct because a mass shooting at a nearby park is an external disaster that causes a sudden influx of critically injured patients, triggering emergency response plans. In contrast, option A, a computer system failure, and option B, a nursing strike, are internal events affecting hospital operations or staffing. Option D, a chemical leak inside the hospital, is also an internal disaster requiring immediate containment to protect those within the facility. Before moving next question, here is something powerful that could transform your NCLEX journey. Over 100,000 nurses have already passed the NCLEX with this course. And now, it is your turn. We are offering you a completely free 5-day trial of our NCLEX crash course. That includes live and recorded NCLEX classes, NGN case studies, over 5,000 exam questions, personalized study planners, and downloadable notes, all designed to get you exam ready faster. Just click the WhatsApp link in the description and type "Hi." That is all it takes. Our team will instantly enroll you, and your success story begins. Now move on to the next question. 11. The primary healthcare provider has prescribed digoxin, 125 micrograms, to be given by mouth once each day. The available medication comes in tablets, with each tablet containing 0.25 milligrams of digoxin. How many tablets should the nurse give to the patient? Please record your answer using 1 decimal place and remember to include a leading 0 if the number is less than 1. The correct answer is 0.5 tablet, or half a tablet. Here's the breakdown. The prescribed dose is 125 micrograms, but the available medication is measured in milligrams. First, convert micrograms to milligrams by dividing 125 by 1,000, which equals 0.125 milligrams. Next, divide the ordered dose, 0.125 milligrams, by the amount in 1 tablet, which is 0.25 milligrams. This results in 0.5. Let's continue with question 12. The nurse is reviewing clinical data for a client who is 24 hours postpartum after a vaginal delivery. Which of the following findings requires immediate follow-up? The options are option A, a white blood cell count of 14,000 per cubic millimeter, or 14.0 times 10 to the power of 9 per liter. Option B, a blood urea nitrogen level of 18 milligrams per deciliter, or 6.426 millimoles per liter. Option C, a capillary blood glucose of 258 milligrams per deciliter, or 14.29 millimoles per liter. And option D, a urinary output of 60 milliliters per hour, or approximately 2.03 ounces. The correct answer is option C, the capillary blood glucose of 258 milligrams per deciliter, as it indicates significant hyperglycemia requiring prompt attention due to risks like diabetic ketoacidosis and impaired healing. Option A, an elevated white blood cell count of 14,000, is common postpartum and not urgent. Option B, a blood urea nitrogen of 18 is normal. And option D, a urine output of 60 milliliters per hour, reflects adequate kidney function and does not require immediate intervention. Now, let's move on to question 13. The nurse is planning a staff educational conference about indwelling urinary catheters. Which of the following information should the nurse include? The options are: option A, sterile gloves should be used to perform urinary catheter care. Option B, urinary specimens may be collected from a catheter bag. Option C, you may irrigate a catheter with warm water for poor outflow. And option D, daily use of soap and water should be used around the urinary meatus. The correct answer is option D. Daily cleaning of the urinary meatus with soap and water is recommended to prevent infection and maintain hygiene in clients with indwelling catheters. Option A is incorrect because sterile gloves are needed only during catheter insertion. Routine care requires only clean gloves. Option B is incorrect since urine should be collected from the sampling port, not the drainage bag, to avoid contamination. Option C is also incorrect because routine irrigation with warm water is not advised due to the risk of introducing infection. See the question 14. A nurse working on the medical surgical unit needs to give a telephone handoff report to the nurse on the cardiac intensive care unit regarding a client who is being transferred due to a sudden change in condition, using the ISBAR, Identification, Situation, Background, Assessment, Recommendation, Communication Framework. Arrange the following information in the correct sequence, from the first step to the last, to ensure a clear, structured, and effective handoff. Arrange in correct sequence. First, in identification, the nurse introduces herself and identifies Mr. Joe Smith as the client with acute coronary syndrome. Second, the situation explains the reason for transfer: unrelieved chest pain and difficulty breathing. Third, the background includes the client's admission for pneumonia and history of diabetes and depression. Fourth, in assessment, the nurse shares vital signs, symptoms of myocardial infarction, ECG findings, and initial interventions like oxygen and morphine. Lastly, the recommendation details the physician's orders for transfer, thrombolytic therapy, and intravenous nitroglycerin. Using ISBAR ensures safe, clear communication during critical handoffs. Now moving on to question 15. A nurse is preparing to verify the placement of a nasogastric tube by obtaining a sample of the aspirated fluid. Proper NG tube placement is essential before administering any medication or nutrition, as incorrect placement can lead to complications like aspiration or lung injury. The question asks, which of the following pH values from the aspirated fluid would most accurately confirm that the NG tube is correctly positioned in the stomach? The options are: option A, a pH of 3.4, option B, a pH of 7, option C, a pH of 5.9, and option D, a pH of 8. The correct answer is option A, a pH of 3.4, as it confirms gastric placement since gastric contents typically have a pH of 5.5 or lower. Option B and option D, with pH values of 7 and 8, are alkaline and suggest possible placement in the lungs or intestines. Option C, a pH of 5.9, is borderline and requires further confirmation, such as a chest X-ray. When pH is above 5.5 or uncertain, always verify placement before proceeding. Moving attention to question 16, a registered nurse is caring for a client who recently underwent a carotid endarterectomy, a surgery that removes plaque from the carotid artery, to restore proper cerebral blood flow. The nurse must closely monitor for potential complications, especially cranial nerve injuries. The question is, which finding indicates hypoglossal nerve injury after this surgery? The options include A, tongue deviation, B, inspiratory stridor, C, tracheal deviation, and D, severe headache. The correct answer is option A, tongue deviation, as it indicates hypoglossal nerve injury, which causes the tongue to deviate toward the affected side. Option B, inspiratory stridor, points to recurrent laryngeal nerve damage affecting the vocal cords. Option C, tracheal deviation, suggests a possible neck hematoma compressing the airway, a surgical emergency. Option D, severe headache, may indicate cerebral hyperperfusion syndrome, a rare but serious post-operative complication. Let's move to another question 17. A nurse is caring for a client who recently sustained a spinal cord injury and is now showing signs of emotional distress, including anxiety, frustration, or sadness. During this critical adjustment phase, the nurse's priority is to support the client's psychosocial needs. The question asks, which nursing intervention best supports emotional well-being and encourages healthy coping? The options are A, administering pain medication to relieve physical discomfort, B, encouraging self-care activities to promote independence, C, facilitating a therapeutic conversation to explore the client's feelings and concerns, and D, providing mobility aids to enhance physical autonomy. The correct answer is option C, facilitating a therapeutic conversation, as it helps the client express emotions, feel heard, and begin coping with psychological stress. Option A focuses on physical pain, not emotional needs. Option B encourages independence but may be premature without emotional support. Option D supports physical recovery but overlooks psychosocial adjustment. Therapeutic communication is key to emotional healing and adaptive coping. Now, let's look at another question. 18. A nurse is caring for a client immediately after administering sumatriptan, a medication used to abort migraine headaches. Given sumatriptan's pharmacologic effects and possible side effects, the nurse closely monitors the client for any concerning signs. The question is, which findings should prompt further assessment and notification of the healthcare provider? The options are A, a blood pressure of 189/98 millimeters of mercury, B, persistent headache, C, flushed skin, and D, reports of nausea. The correct answer is A. The correct answer is the elevated blood pressure, as sumatriptan causes vasoconstriction, which can increase systemic blood pressure and trigger a hypertensive crisis, especially in clients with cardiovascular risks. Option B, persistent headache, is common but not urgent. Option C, flushing, is a harmless side effect. Option D, nausea, is also typical and does not require immediate intervention. Moving forward, question 19. A pregnant client admitted with hyperemesis gravidarum, a severe form of nausea and vomiting, is prescribed ondansetron to help control her symptoms. The nurse must be vigilant about potential serious side effects of this medication. The question is, which side effect requires close monitoring? The options are A, continued nausea and vomiting, B, prolonged QT interval, C, respiratory distress, and D, constipation. The correct answer is B. The correct answer is prolonged QT interval, as ondansetron can extend the QT interval and raise the risk of life-threatening arrhythmias like torsade de pointe, especially in clients with heart issues or electrolyte imbalances. Option A, continued nausea and vomiting, reflects the underlying condition, not a drug effect. Option C, respiratory distress, is not linked to ondansetron. Option D, constipation, may occur but is not a serious adverse effect. Let's continue with another question. 20. A nurse is conducting a comprehensive assessment to evaluate clients' nutritional status and identify those at risk for malnutrition or related complications. The key is selecting the most appropriate screening tool. The options are A, the Klein-Bell scale, B, the Barthel index, C, the Wong-Baker Faces Pain Rating Scale, and D, the Patient-Generated Subjective Global Assessment, or PGSGA. The correct answer is option D, the PGSGA, as it is a validated, client-reported tool specifically designed to assess nutritional status through questions on weight, intake, symptoms, and function. In contrast, option A, the Klein-Bell scale, and option B, the Barthel index, focus on daily living and independence, not nutrition. Option C, the Wong-Baker Faces scale, measures pain, not nutritional risk. The PGSGA helps detect malnutrition early and guide appropriate interventions. Before we move to the next question, here is something that has already changed the lives of over 100,000 nurses. And it can change yours, too. Our NCLEX crash course is now available for a free 5-day trial. And it is packed with live classes, NGN case studies, 5,000 plus exam-style questions, smart study plans, and full educator support. Just hit the WhatsApp link in the description and send "Hi." Your NCLEX breakthrough is one message away. Now, let's review another question 21. A nurse is caring for a client with congestive heart failure who is being medically managed to improve heart function and prevent disease progression. The nurse expects the healthcare provider to prescribe a medication that reduces the heart's workload and prevents harmful changes to the heart muscle. The options are A. Enalapril, B. Verapamil, C. Lovastatin, and D. Gemfibrozil. The correct answer is option A, enalapril, an ACE inhibitor that lowers blood pressure by reducing angiotensin II, promoting vasodilation, and preventing harmful ventricular remodeling in heart failure. Option B, verapamil, is avoided in heart failure due to its negative effect on cardiac output. Options C and D, lovastatin and gemfibrozil, are lipid-lowering agents and do not directly manage heart failure. ACE inhibitors are key in treating congestive heart failure, and nurses must monitor blood pressure, kidney function, and electrolytes during therapy. Let's move on to the next question, 22. A nurse is reviewing lab results for a client on phenytoin for seizure management. The client's serum phenytoin level is 12 micrograms per milliliter, while the therapeutic range is 10 to 20 micrograms per milliliter. The question is, what is the nurse's most appropriate next action based on this level? The options are A. Evaluate for medication non-adherence, B. Instruct the client to skip the next dose, C. Assess for signs of phenytoin toxicity, and D. Document the level as within therapeutic range. The correct answer is option D, documenting the level as therapeutic, since a phenytoin level of 12 micrograms per milliliter is within the target range, indicating effective seizure control without toxicity. Option A is unnecessary because the result reflects good adherence. Option B is inappropriate, as skipping doses can lower levels and trigger seizures. Option C is incorrect, as toxicity is a concern only above 20 micrograms per milliliter. Routine monitoring and continued education are key to maintaining safe therapy. Shifting to another important scenario. 23. A nurse caring for a client with diabetic ketoacidosis accidentally administers 1 unit per kilogram of regular insulin intravenously instead of the prescribed 0.1 unit per kilogram bolus. The question is, what should be the nurse's priority initial action upon recognizing this medication error? The options are A. Notify the primary healthcare provider immediately. B. Complete an incident report. C. Assess the client carefully for signs of hypoglycemia. And D. Withhold the scheduled insulin infusion until further orders. The correct answer is option C, assessing for hypoglycemia, as a tenfold insulin overdose can cause dangerously low blood sugar. Checking symptoms and glucose levels is the top priority. Notifying the provider and reporting the error come next, while stopping the infusion without orders is not the first step. Client safety must be addressed immediately. Moving forward, consider this scenario. 24. A nurse is preparing to admit a client who has just undergone lumbar spinal fusion surgery. To ensure safe post-operative care and proper handling, the nurse instructs the unlicensed assistive personnel to have a specific piece of equipment ready at the bedside. The options are A. Overhead trapeze bar, B. Abduction pillow, C. Transfer board or transfer sheet, and D. Continuous passive motion machine. The correct answer is option C, the transfer board or transfer sheet, as it is crucial for log rolling, which maintains spinal alignment after lumbar fusion. It allows safe turning without twisting the spine. Option A, trapeze bars, aid upper body movement. Option B, abduction pillows, are for hip surgeries. And option D, CPM machines, are used after joint replacements. The transfer board ensures safe handling and supports healing. Next, let's consider client prioritization during initial rounds. Question 25. The nurse must decide which client requires immediate assessment. The options include A. A stable client with diabetes mellitus scheduled for discharge today. B. A 32-year-old female with a tracheostomy noted to have copious secretions obstructing the airway. C. A 16-year-old adolescent scheduled for physical therapy with no complaints. And D. An 80-year-old male with a stage 3 decubitus ulcer needing a routine dressing change. The correct answer is option B, as the client with a tracheostomy and obstructive secretions is at highest risk for airway compromise, following the ABC airway breathing circulation framework. Immediate assessment and suctioning are needed to prevent hypoxia. The other clients are stable or require non-urgent care, making airway management the top priority for safe, effective intervention. Question 26. Let's consider a client in the emergency department presenting with a hypertensive emergency, defined by a blood pressure exceeding 180/120 millimeters of mercury with signs of organ damage. The question is, which intravenous medication should the nurse expect to be prescribed to safely lower the blood pressure? The options are A. Dobutamine, B. Digoxin, C. Nicardipine, and D. Amiodarone. The correct answer is option C. Nicardipine, an intravenous calcium channel blocker that safely lowers blood pressure in hypertensive emergencies. Options A. Dobutamine, B. Digoxin, and D. Amiodarone are not effective for reducing blood pressure. Nicardipine allows controlled reduction and requires continuous monitoring. Question 27. In this scenario, the nurse is assisting with preparing a client who has chronic atrial fibrillation for elective electrical cardioversion. The question is, which action should the nurse prioritize before the procedure? The options are A. Remove the client's peripheral intravenous access device to reduce infection risk. B. Review the client's risk factors for post-procedure bleeding due to anticoagulant use. C. Ensure a water-sealed chest tube drainage system is immediately available at the bedside. And D. Verify that the informed consent form for electrical cardioversion has been properly obtained and documented. The correct answer is option D, verifying informed consent, as it is the nurse's top priority before cardioversion due to the procedure's risks and need for sedation. Option A is incorrect because IV access must be maintained. Option B is not urgent at this moment, and option C is unrelated to cardioversion. Ensuring consent supports both patient rights and legal requirements. Come to next question 28. The nurse is caring for a client with bacterial cystitis who has been prescribed gentamicin. The question is, which laboratory value should the nurse closely monitor to prevent serious complications from this medication? The options are A. Intake and output ratio to assess fluid balance. B. Serum creatinine levels to evaluate kidney function. C. Visual acuity to detect possible eye toxicity. And D. Fasting blood glucose to monitor for metabolic changes. The correct answer is option B, monitoring serum creatinine, as it is the most sensitive indicator of kidney function and crucial for detecting gentamicin's nephrotoxic effects. Option A, intake and output, is helpful but less precise. Option C, visual disturbances, and option D, blood glucose changes, are not associated with gentamicin toxicity. Let's move on to another critical care scenario, 29. The nurse is assessing a client just 3 hours after cardiac surgery and observes a concerning combination of symptoms: a blood pressure of 88/52 millimeters of mercury, jugular venous distension, and muffled heart sounds. These findings strongly point toward a life-threatening condition. The options for immediate intervention are option A, thoracentesis, option B, pericardiocentesis, option C, arthrocentesis, and option D, paracentesis. The correct answer is option B, pericardiocentesis, which removes fluid from the pericardial sac and is the emergency treatment for cardiac tamponade indicated by Beck's triad, hypotension, JVD, and muffled heart sounds. Options A, C, and D involve fluid removal from other body areas and are not appropriate for this condition. Next, let's look at a client assessment scenario 30 involving acute kidney injury, or AKI. The nurse is evaluating a hospitalized client suspected of having AKI. The clinical findings include option A, hypernatremia, option B, metabolic alkalosis, option C, oliguria, and option D, hypokalemia. The correct answer is option C, oliguria, which is a key early sign of acute kidney injury, indicating reduced urine output and impaired kidney function. Option A, hypernatremia, is uncommon. AKI more often leads to hyponatremia. Option B, metabolic alkalosis, is incorrect as AKI typically causes metabolic acidosis. Option D, hypokalemia, is unlikely since potassium tends to accumulate, resulting in hyperkalemia. Prompt recognition of oliguria is critical for early intervention and improved outcomes. Hold on, if you are serious about passing the NCLEX, do not miss this. We are giving you 5 days of completely free access to the same NCLEX crash course that has helped thousands of nurses crush the exam. You get live sessions, NG and case studies, study planners, PDFs, and over 5,000 real NCLEX questions. Tap the WhatsApp link below and type "Hi" to get started instantly. This could be the edge you need. Moving to question 31. The ICU nurse is assessing a comatose patient with a confirmed lesion in the medulla oblongata. When evaluating this client's respiratory status, the nurse should anticipate a breathing pattern consistent with dysfunction in the lower brainstem. The options presented are Option A, Cheney-Stokes respiration, which involves a crescendo-decrescendo pattern of breathing followed by periods of apnea. Option B, apneustic breathing, defined by prolonged inspiratory phases with brief expirations. Option C, central neurogenic hyperventilation, characterized by sustained, rapid, deep respirations. Option D, cluster breathing, marked by groups of irregular respirations followed by apnea. The correct answer is Option D, cluster breathing, as it indicates damage to the medulla or lower pons, disrupting normal respiratory rhythm and signaling poor neurological function. Option A, Cheney-Stokes, is linked to cerebral or metabolic issues. Option B, apneustic breathing, points to pontine damage. Option C, central neurogenic hyperventilation, results from midbrain or upper pons lesions. Cluster breathing is the most specific to medullary injury. Question 32. Moving to next. During a mass casualty event like a major building collapse, nurses must use disaster triage principles to prioritize care when resources are extremely limited. The question is, which client should receive a black tag indicating an expectant status? The correct answer is Option A. The client shows signs of fatal brain injury, unresponsive to pain, agonal respirations, and fixed, dilated pupil, indicating minimal chance of survival, justifying a black tag. Option B likely has a tension pneumothorax, requiring immediate treatment, red tag. Option C shows hypovolemic shock, but is potentially survivable, red tag. Option D, though injured, is conscious and stable, also warranting a red tag. Black tags are reserved for those unlikely to survive to prioritize resources. Moving to the next question. 33, a 68-year-old client is brought to the emergency department after being found on the bathroom floor roughly 10 hours after a fall. During intermittent straight catheterization, the nurse notes a rapid outflow of 800 milliliters of urine with continued heavy drainage. The question is, what is the most appropriate nursing action in this scenario? The options are A, continue to fully drain the bladder and collect a urine specimen to assess for rhabdomyolysis. B, continue draining the bladder completely and insert a Foley catheter to monitor ongoing urine output. C, clamp the catheter temporarily and drain the bladder gradually to reduce the risk of bladder spasms or circulatory collapse. Or D, stop catheterization immediately to reduce the risk of urinary tract infection and notify the healthcare provider. The correct answer is Option C, as rapid drainage of over 500 to 800 milliliters from a distended bladder can cause serious complications like bladder spasms or reflex hypotension. Gradual decompression by intermittently clamping the catheter is safest. Option A misplaces the priority, Option B skips gradual drainage, and Option D focuses incorrectly on UTI prevention instead of hemodynamic stability. Moving on to the next question. 34. A nurse manager reviews the results of a recent staff satisfaction survey, which reveals that team members strongly desire more engagement from leadership and greater involvement in decision-making on the unit. To address this feedback, which management style would be most effective? The options are A, democratic, B, transactional, C, laissez-faire, or D, autocratic. The correct answer is Option A, the democratic leadership style, which promotes collaboration, open communication, and shared decision-making, meeting the staff's request for more involvement. Option B is task-focused with little team input, Option C is too passive, and Option D is overly directive. Democratic leadership best supports engagement, trust, and team empowerment. Now, moving on to the next question. 35. A nurse is reviewing medications for a client whose lab values indicate impaired kidney function. The results are as follows. Creatinine is 3.2 milligrams per deciliter, well above the normal range of 0.6 to 1.2. Blood urea nitrogen, or BUN, is 48 milligrams per deciliter, with a normal range of 7 to 20. Potassium is 4.8 milliequivalents per liter, which is within the normal range of 3.5 to 5.0, and the estimated glomerular filtration rate, or GFR, is 22 milliliters per minute, far below the normal of greater than 60. Based on these results, which medication should the nurse clarify with the healthcare provider before administering? The options are A. Bupropion, 150 milligrams extended release by mouth daily. B. Clonidine, 0.1 milligrams by mouth daily. C. Albuterol, 2.5 milligrams via nebulizer daily. And D. Captopril, 12.5 milligrams by mouth daily. The correct answer is option D. Captopril. As an ACE inhibitor, it can worsen kidney function or cause hyperkalemia in clients with severe renal impairment, like a creatinine of 3.2 and GFR of 22. So it should be clarified before administration. Options A. Bupropion, B. Clonidine, and C. Albuterol are not nephrotoxic and do not require the same precaution. Always review renal function before giving kidney-impacting drugs like ACE inhibitors. Let's move on to the next question. 36. While admitting a new client to the medical surgical unit, the nurse is collecting health history information. When assessing the client's menstrual history, which of the following questions would be the most appropriate? The options are A. How many sexual partners have you had? B. Do you have a family history of any type of cancer? C. Have you noticed any missed or irregular periods? And D. Do you regularly use condoms during sexual activity? The correct answer is option C. Have you noticed any missed or irregular periods? This directly assesses menstrual function. Option A relates to sexual history, option B to general family health, and option D to contraception, not menstrual patterns. Asking about cycle regularity helps identify hormonal or reproductive issues using tools like the LMNOP acronym. Let's continue with the next question. 37. During clinical practice, a nursing student learns the importance of being honest and transparent with clients, even when delivering difficult news about a diagnosis or prognosis. This behavior reflects which fundamental ethical principle in nursing? The options are A. Beneficence, B. Veracity, C. Non-maleficence, and D. Fidelity. The correct answer is option B. Veracity, which is the ethical duty to tell the truth, supporting trust and informed decision-making. Option A. Beneficence focuses on doing good. Option C. Non-maleficence, on avoiding harm, and option D. Fidelity, on keeping promises. Only veracity specifically emphasizes honesty in client care. Let's focus on next question 38. The nurse is providing discharge instructions to the spouse of a client who just had left eye cataract surgery. Which of the following statements by the client's wife indicates correct understanding of the post-operative care? The options are A. He should sleep on his left side so he doesn't roll onto his right. B. He should sleep on his right side to protect the eye that was operated on. C. I will need to give him antibiotic eye drops every hour for the next few days. And D. He needs to sleep sitting fully upright so the eye doesn't swell. The correct answer is option B. He should sleep on his right side to protect the eye that was operated on. After left eye cataract surgery, sleeping on the non-operative side helps prevent pressure or trauma. Option A risks damaging the surgical eye. Option C suggests overly frequent eye drops. And option D, sleeping fully upright, is unnecessary. Elevating the head 30 to 45 degrees with an eye shield is sufficient for recovery. Now moving on to the next question, 39. The nurse is preparing to administer a unit of packed red blood cells, also known as PRBCs. Which of the following actions should the nurse take? The options are A. Obtain a bag of 250 milliliters of 0.9% saline. B. Obtain a bag of 250 milliliters of saline dextrose, 5% in water, also called D5W. C. Insert a 22-gauge intravenous catheter. And D. Initiate continuous telemetry monitoring. The correct answer is option A. Obtain a 250 milliliter bag of 0.9% sodium chloride, as it is the only intravenous fluid compatible with blood transfusions. Option B, D5W, can cause hemolysis. Option C, a 22-gauge catheter is too small, and 18 to 20 gauge is preferred. Option D, continuous telemetry, is not routine unless the patient has a cardiac issue. Normal saline, a large bore intravenous, and close monitoring are essential for safe transfusion. Now let's move on to the next question. 40. A nurse is triaging a client who was exposed to a hazardous chemical spill at a manufacturing plant. The client is alert but unable to walk, has a respiratory rate of 28 breaths per minute, and a capillary refill time of less than 2 seconds. Based on this assessment, which triage category is most appropriate? The options are A. Delayed, also known as yellow, B. Immediate or red, C. Expectant or black, and D. Minor or green. The correct answer is option A. Delayed, yellow. Under the START triage system, an alert, stable client with normal breathing and perfusion but unable to walk is considered moderately injured and can wait for treatment. Option B, red, is for life-threatening cases. Option C, black, is for those unlikely to survive. And option D, green, is for ambulatory patients with minor injuries. Yellow is appropriate for non-ambulatory but stable individuals. Before we jump back in, imagine having access to the same NCLEX prep tools that helped over 100,000 students pass on their first try. That is what you get with our NCLEX crash course. And for a limited time, we are giving you 5 days free to try it all. Live classes, NGN case studies, 5,000 plus questions, expert notes. It is all yours. Click the WhatsApp link that is given in description box and say hi and start your journey to passing today. Now, on to the next question. 41. The nurse is administering phosphate-binding medications to a client who has been diagnosed with hypocalcemia or low calcium levels. What is the primary rationale for giving these medications? The options are A. Because calcium is lost from the body as phosphorus is excreted. B. Because calcium levels are directly controlled by phosphorus excretion. C. Because lowering serum phosphorus levels causes an increase in serum calcium levels. And D. Because serum phosphorus must be above a specific level before calcium levels can rise. The correct answer is option C, because lowering serum phosphorus allows calcium levels to rise due to their inverse relationship. Phosphate binds calcium, reducing free levels. Phosphate binders help correct hypocalcemia. Option A is incorrect. Excreting phosphorus helps, not harms. Option B oversimplifies calcium regulation. And option D falsely implies a set phosphorus threshold is needed for calcium to rise. Managing phosphorus is key in restoring calcium balance, especially in kidney disease. Now let's move on to a medication calculation question 42. The primary healthcare provider has prescribed 0.5 grams of cefaclor to be taken by mouth twice a day. The nurse has cefaclor capsules available, and each capsule contains 500 milligrams. So, how many capsules should the nurse administer per dose? The correct answer is 1 capsule. Here's why. First, we need to convert grams to milligrams. 0.5 grams is the same as 500 milligrams. Next, we use a simple formula. The number of capsules equals the dose ordered divided by the dose available per capsule. That's 500 milligrams ordered, divided by 500 milligrams per capsule, which equals 1 capsule. Therefore, the nurse should administer 1 capsule per dose, taken twice a day, just as prescribed. A few extra tips to keep in mind. Always match your units when doing medication calculations. So if the prescription is in grams and the medication label is in milligrams, convert accordingly. Question 43. Let's consider a situation where a client is diagnosed with a Helicobacter pylori infection, commonly referred to as H. pylori. The nurse is anticipating which medication the healthcare provider is most likely to prescribe as part of the treatment plan. The options are as follows. Option A is desiclomine. Option B is metoclopramide. Option C is valacyclovir. And option D is amoxicillin. The correct answer is option D, amoxicillin, a broad-spectrum antibiotic used to treat H. pylori infections as part of combination therapy with another antibiotic and a proton pump inhibitor. Option A, dicyclomine, is an antispasmodic. Option B, metoclopramide, improves gastric motility. And option C, valacyclovir, is an antiviral. None target H. pylori. Amoxicillin directly treats the infection, making it the appropriate choice. Question 44. A client with adrenal insufficiency, also known as Addison's disease, is admitted with classic symptoms including fatigue, low blood pressure, and electrolyte imbalances. The nurse must decide which intervention to prioritize. The options are option A, administer the prescribed hydrocortisone immediately. Option B, offer the client salty snacks and encourage fluid intake. Option C, conduct a thorough assessment of the client's skin integrity. And option D, encourage the client to take frequent rest periods to conserve energy. The correct answer is option A, administer the prescribed hydrocortisone immediately. In Addison's disease, cortisol deficiency can lead to adrenal crisis, causing life-threatening hypotension and shock. Option B, offering salty snacks, is supportive but not urgent. Option C, assessing skin integrity, and Option D, encouraging rest, are important for long-term care but not critical in an acute crisis. Prompt cortisol replacement is the top priority. Come to the next question. 45. In the pediatric emergency department, the nurse must decide which client needs immediate assessment and treatment. The options are A, a child with a superficial forearm burn reporting pain at 5 out of 10, B, a child who is drooling, having trouble swallowing, and sitting in a tripod position, C, a child with a mild fever and headache, and D, a child with excessive thirst, dry mucous membranes, and a weak, thready pulse. The correct answer is Option B, as the child's drooling, difficulty swallowing, and tripod position are hallmark signs of epiglottitis, a life-threatening airway emergency requiring immediate intervention. Option A is a superficial burn, not airway-threatening. Option C suggests mild illness, and Option D points to possible dehydration or diabetic ketoacidosis, which progresses more slowly. Airway emergencies always take top priority in pediatric triage. Question 46. While monitoring a client in active labor, the nurse notes that during each uterine contraction, the fetal heart rate, FHR, drops from a baseline of 150 beats per minute to 120 beats per minute for about 10 seconds, then returns to baseline as the contraction ends. At this point, it's essential to classify the type of fetal heart rate pattern observed. The options are A, late deceleration, B, moderate variability, C, early deceleration, and D, marked variability. The correct answer is Option C, early deceleration, which is a gradual fetal heart rate decrease that mirrors the timing of a contraction. It is caused by fetal head compression and is a benign, normal finding during labor. Option A, late decelerations, suggests fetal distress due to uteroplacental insufficiency. Option B, moderate variability, indicates fetal well-being, but is unrelated to deceleration timing. Option D, marked variability, signals possible fetal stress, but does not describe a deceleration pattern. Early decelerations require no intervention. Moving to the next question. 47. A newborn is diagnosed with erythroblastosis fetalis. The options are A, excessive red blood cell production requiring phlebotomy, B, fetal red blood cells undergo hemolysis due to blood type incompatibility, C, the newborn cannot metabolize phenylalanine, and D, red blood cells take on a sickle shape and become sensitive to low oxygen. The correct answer is Option B, as erythroblastosis fetalis is caused by maternal antibodies destroying fetal red blood cells due to Rh or ABO incompatibility, leading to hemolysis and fetal anemia. Option A refers to polycythemia, Option C to PKU, and Option D to sickle cell anemia, none of which involve immune-mediated hemolysis. Option B best describes the condition's pathophysiology. Moving to the next question. 48. A child has been admitted to the hospital following a concussion. During ongoing neurological assessments, the nurse wants to detect any early signs of worsening neurological status. The options are Option A, changes in the child's level of consciousness, LOC, such as increased irritability or lethargy. Option B, elevations in blood pressure readings. Option C, measurements of intracranial pressure, ICP, via invasive monitoring. Option D, changes in pupil size and reactivity to light. The correct answer is Option A, changes in the child's level of consciousness, such as increased irritability or lethargy. These are often the earliest and most sensitive signs of neurological deterioration in head injuries. Option B, blood pressure changes, and Option D, pupil changes, are typically late signs. Option C, invasive ICP monitoring, is not an early or routine bedside tool. Early recognition of altered LOC is key to preventing serious complications. Let's focus on another question. 49. The nurse is preparing to apply soft limb restraints to a client to ensure their safety and prevent injury. The options are A, inform the client clearly about the reason for the restraints and the expected behavior needed for their removal. Option B, update the client's family about the use of restraints immediately. Option C, obtain and document the client's pulse and blood pressure before applying the restraints. Option D, offer the client snacks and fluids before applying restraints to prevent dehydration or hunger. The correct answer is option A, inform the client clearly about the reason for the restraints and the expected behavior for their removal. This supports ethical care, promotes cooperation, and preserves the client's dignity. Option B, notifying the family, is important, but not the first priority. Option C, obtaining vitals, and Option D, offering snacks, are appropriate later, but do not take precedence over clear communication with the client. Moving to the next question 50. During a cultural competency training session, a nursing student inquires about the concept of acculturation. The options presented include A. Acculturation means that a person permanently moves from one country to another. B. Acculturation occurs when someone leaves their homeland. C. Acculturation involves adopting the beliefs, values, and behaviors of a new culture while still maintaining aspects of their original culture. And D. Acculturation is about being aware of personal biases and appreciating other cultures. The correct answer is option C, as acculturation refers to the process of blending into a new culture while retaining aspects of one's original culture. Option A describes immigration, the act of relocating. Option B refers to emigration, leaving one's home country. Option D confuses acculturation with cultural humility, which involves respecting and acknowledging other cultures but is not the same process. Understanding acculturation supports culturally sensitive care. Quick heads up before we continue. If you have not tried our NCLEX crash course yet, now is the perfect time. You can try it free for 5 days, no credit card, no catch. It comes with live and recorded classes, NGN case practice, thousands of exam questions, and personalized study tools. Just hit the WhatsApp link and send us a hi. Simple as that. Let us help you get NCLEX ready. Faster. Moving to the next question. 51. The scenario involves a nurse supervising a student nurse who is about to perform a sterile procedure. The question is, which of the following student actions indicates a need for immediate correction? The options are as follows. Option A. The student reaches over the sterile field to grab a pair of sterile gloves. Option B. The student sets up the sterile field on a dry, flat surface. Option C. The student moves slowly and deliberately while arranging sterile drapes. Option D. The student keeps the sterile field positioned at waist level throughout the procedure. The correct answer is Option A, reaching over the sterile field to grab gloves, which violates sterile technique by risking contamination from the arms or clothing. Option B is correct practice, as a dry, flat surface prevents contamination. Option C is appropriate because slow, deliberate movements reduce air disturbance. Option D is also correct. Keeping the sterile field at or above waist level helps maintain sterility. Proper technique is essential for infection prevention. Moving to the next question. 52. We consider a clinical assessment scenario. When assessing a client for dehydration, which of the following clinical findings should the nurse expect to observe? The options are A. Headache and increased urinary output. B. Weight gain and peripheral edema. C. Hypertension and decreased urinary output. And D. Hypotension, headache, and dry mucous membranes. The correct answer is Option D, hypotension, headache, and dry mucous membranes. Classic signs of dehydration due to fluid loss and reduced perfusion. Option A is incorrect because dehydration causes decreased, not increased, urine output. Option B describes fluid overload, not dehydration. Option C is wrong since dehydration leads to low, not high, blood pressure. Recognizing these signs ensures timely and effective intervention. Focus on this question 53. The nurse is taking vital signs of a pregnant client in active labor. While inflating the blood pressure cuff, the fetal monitor shows a brief increase in the fetal heart rate that returns to baseline within about 15 seconds. The options are, Option A is to notify the healthcare provider. Option B is to document and continue to monitor. Option C suggests placing the mother on her left side. Option D is to administer 100% FiO2 by face mask. The correct answer is Option B, as brief fetal heart rate accelerations are reassuring and indicate good oxygenation and neurological status. Option A is incorrect. No provider notification is needed for a normal finding. Option C, repositioning, is used for non-reassuring patterns. And Option D, oxygen, is reserved for fetal distress. The nurse should simply document and continue monitoring. Question 54. Let's take a closer look at this clinical situation. A nurse is caring for a client diagnosed with schizophrenia who has been prescribed risperidone. The options are Option A, noticeable weight loss and increased energy levels. Option B, greater emotional instability with rapid mood swings. Option C, a stable and coordinated gait without signs of tremors or rigidity. And Option D, a marked reduction in paranoid thoughts and suspicious behavior. The correct answer is Option D. Risperidone treats positive symptoms of schizophrenia, so reduced suspiciousness shows it is effective. Option A is incorrect, as weight gain, not loss, is common. Option B, mood swings, are not a desired effect. Option C, stable gait, may reflect fewer side effects, but not therapeutic success. Reduced paranoia best indicates the medication is working. Here's a question 55 related to pre-procedural care. The nurse is preparing a client scheduled for a colonoscopy and must consider which medication would most likely be prescribed to ensure complete bowel cleansing beforehand. The options are Option A, docusate sodium, Option B, loperamide, Option C, polyethylene glycol 3350, also known as PEG 3350, and Option D, famotidine. The correct answer is Option C, PEG. 3350 is an osmotic laxative that draws water into the colon to promote bowel movements, making it ideal for colonoscopy prep. Option A, docusate sodium, is too mild. Option B, loperamide, slows bowel activity and is inappropriate. Option D, famotidine, reduces stomach acid and has no role in bowel cleansing. Let's walk through a critical safety scenario. Question 56. A nurse enters a client's room and finds the client lying on the floor, appearing unresponsive. The options are Option A, initiate a code blue immediately. Option B, assess the client's respiratory effort. Option C, check the client's carotid pulse. And Option D, attempt to elicit a response by shouting the client's name. The correct answer is Option D. The first step in basic life support is to check for responsiveness by using verbal cues, such as calling the person's name. Option A, calling a code blue, and Option B, checking for breathing, come after confirming unresponsiveness. Option C, checking the carotid pulse, is also later in the sequence. Assessing responsiveness is always the initial action. Here's a high-stakes emergency triage situation to consider. Question 57. A client arrives at the emergency department reporting what feels like a panic attack, accompanied by nausea, chest discomfort, and a strong sense of impending doom. The options are Option A, assess the client for suicidal ideation. Option B, obtain a 12-lead electrocardiogram, ECG. Option C, establish a therapeutic rapport with the client. And Option D, ask the client about any precipitating events leading to the attack. The correct answer is Option B. Although the symptoms may resemble a panic attack, they could indicate a serious cardiac event like a myocardial infarction. Chest discomfort, nausea, and a sense of doom warrant immediate assessment with a 12-lead ECG to rule out life-threatening causes. Options A, C, and D involve emotional support, which can follow once the client is medically stabilized. Prioritizing physical safety makes the ECG the top priority. Here's a question focusing on safe medication administration. Question 58. The nurse is reviewing medication prescriptions for assigned clients and must identify which one needs clarification before proceeding. The options are Option A, warfarin for a client with an international normalized ratio, or INR, of 1.8 seconds. Option B, digoxin for a client whose serum potassium level is 3.1 milliequivalents per liter. Option C, enoxaparin for a client with a platelet count of 155,000 per cubic millimeter. And Option D, lisinopril for a client whose serum creatinine level is 0.6 milligrams per deciliter. The correct answer is Option B. Digoxin should be withheld when potassium is low, like a level of 3.1, as hypokalemia increases the risk of digoxin toxicity and life-threatening arrhythmias. Option A's INR of 1.8 is slightly low but acceptable for warfarin dosing. Option C's platelet count is normal, so enoxaparin can be given. Option D's creatinine is normal and not a reason to hold lisinopril. Low potassium with digoxin requires immediate action. Question 59. Let's examine a case involving pediatric trauma response. A home health nurse is conducting a follow-up visit with a child who was recently relocated to a new home after experiencing abuse. The options are: Option A, willingness to explore new environments and try new activities. Option B, rapid social engagement and forming new friendships easily. Option C, improved academic performance and increased focus in school. And Option D, reluctance or avoidance of social interactions and emotional withdrawal. The correct answer is Option D. Abused children often show emotional withdrawal, fear of social interaction, and difficulty trusting others as a protective trauma response. Option A is incorrect because they usually feel anxious in unfamiliar settings. Option B is unlikely, as they often struggle to form friendships. Option C is wrong, since trauma can impair concentration, leading to poor school performance. Emotional guardedness is the most expected behavior. Before we hit the next question, let us boost your prep. You can now unlock our full NCLEX crash course free for 5 days. That includes live expert-led classes, next-gen case studies, thousands of questions, downloadable notes, and 24/7 educator support. Click the WhatsApp link in the description and message, "Hi." We will get you started right away. Move to question 60. Let's review a case involving endocrine function and weight changes. A nurse is assessing a client who reports recent, unexplained, and significant weight gain. Laboratory findings reveal low levels of thyroid hormones. The options are: Option A, cancer; Option B, hypothyroidism; Option C, chronic obstructive pulmonary disease, or COPD; and Option D, cardiac failure. The correct answer is Option B, hypothyroidism, as low levels of T3 and T4 reduce the basal metabolic rate, leading to weight gain without increased intake. Option A is incorrect since cancer usually raises metabolism, causing weight loss. Option C is wrong because COPD may increase calorie needs due to labored breathing. Option D, cardiac failure, may cause fluid weight gain but does not lower metabolism. Hypothyroidism best explains the metabolic slowdown and weight gain. Let's move into a question 61 focused on medication safety and client education. A nurse has just completed teaching a client who has been prescribed enalapril for hypertension. The options are: Option A, I will notify my prescriber immediately if I notice any swelling of my face or lips. Option B, I should weigh myself daily to monitor for fluid retention while taking this medication. Option C, it is important to eat plenty of potassium-rich foods like bananas and oranges while on this drug. And Option D, I will need regular blood tests to monitor my liver function while on this medication. The correct answer is Option A. Enalapril, an ACE inhibitor, can cause life-threatening angioedema, sudden swelling of the face, lips, or throat, requiring immediate reporting. Option B is incorrect as enalapril is not a diuretic, and daily weights are not routinely needed. Option C is wrong because enalapril can raise potassium levels, so excess potassium should be avoided. Option D is inaccurate since routine liver tests are not required. Monitoring kidney function and electrolytes is more relevant. Recognizing angioedema is the top priority. Let's now consider a scenario involving head injury monitoring. Question 62. A nurse is assessing a client recently diagnosed with a concussion after a minor head trauma. The options are: Option A, a persistent headache reported by the client; Option B, a Glasgow Coma Scale score of 13; Option C, a heart rate of 56 beats per minute; and Option D, the client appears drowsy but is easily arousable. The correct answer is Option C, a heart rate below 60 beats per minute, which may signal increased intracranial pressure after head trauma. This bradycardia, especially with other signs like hypertension or irregular breathing, suggests brainstem compression and requires immediate attention. Options A, B, and D reflect mild or expected post-concussion symptoms and are less concerning. Now, let's consider a situation involving a medication-related complication. Question 63. A nurse is caring for a client who suddenly develops muscle spasms and abnormal posturing of the neck and face shortly after receiving fluphenazine for schizophrenia. The client is diagnosed with acute dystonia. The options are: Option A, diphenhydramine; Option B, mannitol; Option C, thiamine; and Option D, haloperidol. The correct answer is Option A, diphenhydramine, as it effectively treats acute dystonia. by restoring the dopamine-acetylcholine balance disrupted by antipsychotics like fluphenazine. Option B, mannitol, is for intracranial pressure. Option C, thiamine, treats Wernicke's encephalopathy. And option D, haloperidol, could worsen dystonia. Diphenhydramine is the rapid response treatment of choice for this reaction. Let's now look at a case involving infection monitoring. Question 64. A nurse is caring for a client who has been admitted with suspected osteomyelitis. To help confirm the diagnosis and track the client's progress during treatment, which laboratory test should the nurse anticipate will be ordered? The options are Option A, erythrocyte sedimentation rate. Option B, serum potassium levels. Option C, serum creatinine levels. And option D, prothrombin time. The correct answer is option A, erythrocyte sedimentation rate, ESR, as it is a common inflammatory marker used to support the diagnosis and monitor treatment of osteomyelitis. Option B, serum potassium, and option C, serum creatinine, are unrelated to bone infection. Option D, prothrombin time, assesses clotting, not inflammation. ESR helps track response to therapy in osteomyelitis. Question 65. Let's now focus on a question related to trauma-informed care and post-crisis psychological support. A nurse is providing care and emotional support to a group of clients who recently witnessed a mass shooting. To promote psychological recovery and build resilience among these survivors, which intervention should the nurse prioritize? The options are Option A, encourage the clients to schedule follow-up psychiatric screenings at the local behavioral health clinic. Option B, facilitate the establishment of a regularly scheduled support group for the survivors to meet and share experiences. Option C, advise the clients to suppress memories of the event to avoid reliving the trauma. And option D, recommend that the client spend time alone reflecting on the event and journaling their thoughts. The correct answer is option B, establish a regularly scheduled support group with other survivors. Peer support fosters connection, reduces isolation, and promotes healing after trauma. Option A, psychiatric follow-up, is important but secondary. Option C, encouraging memory suppression, is harmful and increases PTSD risk. Option D, journaling, may help individually but lacks the benefits of social connection. Group support is the most effective initial step. Focus on this question 66. A nurse is caring for a client who has overdosed on tricyclic antidepressants, TCAs. Which complication represents the most serious and life-threatening effect of such an overdose? The options are A, seizures, B, hyperpyrexia, C, metabolic acidosis, and D, cardiac arrhythmias. The correct answer is option D, cardiac arrhythmias, as they are the most life-threatening complication of tricyclic antidepressant TCA overdose. TCAs block cardiac sodium channels, causing conduction delays and potentially fatal arrhythmias. Option A, seizures, may occur but are less deadly. Option B, hyperpyrexia, is not typical. And option C, metabolic acidosis, is secondary. Prompt ECG monitoring and IV sodium bicarbonate are critical for managing TCA toxicity. Let's focus on this question 67. A nurse is reviewing the medical history of a client who has been newly prescribed naproxen for joint pain. Which pre-existing condition in the client's history would require the nurse to clarify the medication order with the healthcare provider before administering it? The options are A, rheumatoid arthritis, B, congestive heart failure, C, HF, C, osteoarthritis, and D, psoriatic arthritis. The correct answer is heart failure, as NSAIDs like naproxen can cause fluid retention, elevate blood pressure, and impair kidney function, worsening heart failure. The nurse should always clarify its use in such clients. In contrast, rheumatoid arthritis, osteoarthritis, and psoriatic arthritis are conditions where NSAIDs are typically appropriate unless other contraindications exist. Moving to the next question. 68. The nurse is caring for a client with ascites and hepatic encephalopathy. Which prescription should the nurse clarify with the primary healthcare provider? The options are A, alprazolam, B, rifaximin, C, lactulose, and D, spironolactone. The correct answer is option A, alprazolam. As a benzodiazepine, it can worsen confusion and sedation in clients with hepatic encephalopathy, increasing the risk of respiratory depression and falls. Option B, rifaximin, and option C, lactulose, help reduce ammonia levels and are appropriate treatments. Option D, spironolactone, is used to manage ascites while preserving potassium. Alprazolam should be questioned due to its harmful effects in this condition. Now let's focus on another question. 69. The nurse in the emergency department is monitoring a client whose ECG tracing shows sinus bradycardia. The options are A. Establish vascular access and request atropine. B. Assess blood pressure and level of consciousness. C. Obtain and review current medications. And D. Document findings and reassess in 1 hour. The correct answer is option B. Assess blood pressure and level of consciousness to determine if the client with sinus bradycardia is hemodynamically stable. If signs of poor perfusion are present, immediate intervention is needed. Option A is premature without assessing symptoms. Option C, reviewing medications, and option D, delaying action, are inappropriate until stability is confirmed. Initial assessment guides safe and timely care. Picture this. 5 days from now, you are scoring higher, understanding core topics better, and feeling more confident than ever. All because you took 10 seconds to click the WhatsApp link and send us a hi. That is all it takes to access our NCLEX crash course, free for 5 days. Live sessions, NGN prep, expert tips, everything you need to turn your NCLEX dream into a reality. Let's break down next question 70. When asked to define cyanosis, the nurse must give an accurate clinical explanation. The options are A. Yellowish discoloration due to excessive oxygenation. B. Blue coloring of skin and mucous membranes from poorly oxygenated blood. C. Cyanosis is the primary sign of pneumonia. And D. Bluish discoloration due to poor peripheral circulation, even if oxygen levels are normal. The correct answer is option B. Cyanosis is a bluish tint of the skin and mucous membranes caused by high levels of deoxygenated hemoglobin, indicating poor oxygenation. Option A is incorrect. Yellowing is jaundice, not cyanosis. Option C is wrong because cyanosis is not specific to pneumonia. Option D confuses peripheral discoloration with systemic hypoxia, which defines true cyanosis. Recognizing location and cause is essential for accurate assessment. Let's turn our attention to this critical care scenario. Question 71. The nurse is caring for a client in vasodilatory shock who is receiving vasopressin. The options are A. Encouraging fluid intake of at least 2 liters per day. B. Checking blood pressure every 15 minutes. C. Monitoring urine output every 2 hours. And D. Assessing for signs of myocardial ischemia every 4 hours. The correct answer is option B. Checking blood pressure every 15 minutes, as vasopressin is a potent vasoconstrictor used to raise low blood pressure in shock. Frequent monitoring ensures effectiveness and prevents hypertension. Option A is inappropriate since fluid needs in shock are managed intravenously. Option C, monitoring urine output, is helpful but less urgent. Option D, assessing for myocardial ischemia every 4 hours, is too infrequent during acute management. Blood pressure monitoring is the top priority. Focus on next question. 72. In caring for a hospitalized 4-year-old with an autoimmune disorder and low white blood cell count, the nurse must prioritize both emotional and physical safety. The options are A. Provide the child with a private room. B. Encourage them to play with other children in the common area. C. Advise the parents to only visit during visiting hours. And D. Allow the parents to stay as much as they'd like. The correct answer is option D. Allowing the parents to stay as much as they'd like. This supports emotional security and reduces separation anxiety in hospitalized children. Option A may increase isolation and distress. Option B is unsafe due to infection risk in immunocompromised children. Option C, limiting parental visits, worsens fear and stress. Family presence is key to comfort and healing. Moving to the next question. 73. When creating a care plan for a client with Bell's palsy, the nurse must first focus on physiological safety over emotional or secondary concerns. The options are A. Risk for infection. B. Risk for disturbed sensory perception. C. Risk for disturbed body image. And D. Risk for ineffective tissue perfusion. The correct answer is focused on protecting sensory and safety functions, especially the eye, due to facial nerve dysfunction in Bell's palsy. Incomplete eyelid closure increases the risk of corneal injury, making this the top priority. Option A, risk for infection. is less relevant as infection is not the primary concern. Option C, disturbed body image, matters but is not urgent. Option D, ineffective tissue perfusion, is unrelated to this neurological condition. Protecting vision and sensory function takes priority in care planning. Moving to next important question, 74. In patients undergoing nasogastric suctioning, especially pediatric clients, the nurse must stay alert for fluid and electrolyte disturbances due to ongoing gastric content loss. The options are A, hyponatremia, B, metabolic acidosis, C, hyperkalemia, and D, hypercalcemia. The correct answer is A, hyponatremia. Gastric secretions are rich in sodium, and prolonged suctioning removes this essential electrolyte, predisposing the client to hyponatremia. This condition can present with confusion, lethargy, muscle weakness, or even seizures, making regular monitoring crucial. Looking at the incorrect choices, B, metabolic acidosis is unlikely. In fact, loss of hydrochloric acid via suction typically causes metabolic alkalosis, not acidosis. C, hyperkalemia is also incorrect. Potassium is lost along with gastric fluids, so hypokalemia is more common in this situation. Lastly, D, hypercalcemia is not typically associated with nasogastric suction. It is usually linked to conditions like hyperparathyroidism or malignancy.